Today, we're hoping to present a mirror back to you, to provide a recognition in terms of understanding your experiences and your feelings, your thoughts, your ideas, using scenarios, using actors to provide you with hopefully a recognition that we've been listening and we've been taking on board the incredible amount of work and inspiration that you provided us.
I think it's fairly clear from that Edward is under considerable stress.
Why did you have to go and call Liz and John?
Some help in order to help how to relax.
Now my son thinks that we're feeble-minded.
Just to understand yourself and your own needs.
If we were empowering this lady, she can use a phone to ring somebody else, like a care coordinator. I can't see how a GP can possibly take every ad hoc phone call.
I'm really sorry, Mrs. Cranford, but you really need to speak to your own GP about that and make an appointment. I'm sure they can best advise you.
The surgery I use, always, if the child's under 5, they'll always let you be seen at the last point of the day at the emergency appointment.
The difficult bit is this implementation bit. And how do we actually turn all these fantastic ideas about the way we work, the infrastructure of the system that we work in, and the infrastructure of the system that we receive care from, into a reality. The best way of changing the system is to change it bit by bit, but at pace and at scale. And I believe that the system is already changing. If you go to Knutsford, your GP will have access to records from the district nurse and vice versa. If you go to Disley, there are care administrators working across the social, the care, the third sector, coordinating people's care. To implement this new system, the biggest change has to happen from ourselves. We have to change our attitude towards the system. We have to demand far more from it in terms of being empowered to make the right decisions for ourselves. And as a professional, I have to start giving up old default ways of working and thinking far outside my professional bubble that I have done.
So the empowered person is very much taking the view that we are the most important part of this process as individuals. And the principle of the empowered person is also about when we do need to access care services, health and social care services, that we actually are empowered to do that in a way where we actually know what it is that we want, be able to articulate that to the people that we're talking to, and know how to find our way through a system which sometimes, from the work you've done this morning, can actually be quite challenging and quite difficult.
This app is just as good.
And so is this website. It says the best thing to do is to take her into the pharmacy first.
Apart from pharmacists being the first port of call, pharmacies need training, I think, and support in promotion of their services.
I hope you move out of this room today feeling that we have started that process today from co-production, co-design into co-delivery.